Your guide to pilonidal sinus repair surgery with Gastrosurgery UK. What is pilonidal sinus surgery? Pilonidal sinus surgery involves the cutting of the sinus tract between the buttocks to prevent recurring of pilonidal sinus. The surgery is only done in cases where there is a recurring problem of pilonidal sinus, chronic. What anesthesia is used? General anesthesia is used for pilonidal sinus surgery. What is the preparation for the procedure? Report at the specified time. Before the surgery, the medical staff will shave the infected area. Fasting would be suggested as per the anesthetist's requirement. What happens on the day? Anesthesia will be administered. The pilonidal cyst will be cut and the infected material will be drained out. The pilonidal cyst and the inflamed tissue will also be removed using excision. The wound may be kept open and only packed with surgical gauze. Alternatively, the wound may be closed using stitches. You will be able to leave hospital after the anesthesia wears off as per the nurse's instructions. What are the risk factors involved? Since the wound is to be kept open, it might take several weeks for the wound to heal. There is a possibility of the wound breaking open and causing infection. Another surgery is required in this case. The problem may recur again, requiring another surgery. The scar may be painful and may also thicken and turn red. For obese people and smokers, there is more risk of wound infection leading to chest infection, thrombosis, and also heart and lung complications. How does the postoperative recovery takes place? You will be asked to keep the wound clean and dry. The dressing will have to be changed every day if the wound has been kept open. You will be asked to keep the area free of hair near the wound. The wound usually takes from about 10 days to 6 weeks, depending on the type of surgery, to heal. During these days, you will feel a little uncomfortable to resume your normal activities. If the wound was closed using stitches, infection can creep in sometimes in the stitches. You must contact your doctor immediately. For additional information and appointments, please contact us at +44 0 2070 999 333. Alternatively, you can email us your queries on gastrosurgery@gmail.com. Information provided is only for educational purpose. Contact your health consultant or emergency services depending on your symptoms. Do not self-diagnose, treat, or take healthcare decisions based on the information given. Thank you.